How's everyone doing today? How's everyone doing? Woo! So this is intense. I also want to thank the caregiver and the wife for sort of the courage to share her story. I also wanted to share a story that Victor alluded to, and also just wanted to check is if David Rothenberger's in the audience today. Hi, Dr. Rothenberger. So this was a response from a medical student named Caitlin. This was a suicide note that she left. Quote, "Dear Mama and Daddy, I am so dreadfully sorry for the unimaginable pain and hurt that I have caused you by taking my life. I am sorry for hiding from you that I was so deeply sad. I am sorry for not letting you know that I felt like I simply no longer wanted to live my life. I am sorry that I did not let you in on my perpetual despair that I lived in." Shortly thereafter, her mother also took her life. I connected with Dr. Rothenberger through the National Academy of Medicine, and he was chairman at the University of Minnesota of Surgery. So Dr. Rothenberger's response to this note was, quote, "I realize that the suicides of Caitlin and her mother are deeply disturbing to me because I have lived in denial of the dark side of the medical profession and its unwritten code. The code that says medical students should keep their mouths shut, that residents can be blamed since it is how they will learn, and that repeatedly being pushed to the brink of exhaustion is a necessary part of being a caring physician, and that if a few drop out along the way, it is because they were weak and somehow deficient. Somehow I escaped, survived, and thrived, but it is not clear to me how that happened. Why was I not one of those statistics?" See, everyone here has a reason why they're in the room, why you took time on a Friday morning in the middle of July to come sit here at 8 a.m. For me, 5 years ago, I felt the same way that Dr. Rothenberg did. I burned out. I failed my surgery shelf exam, I gained 70 pounds, and I didn't tell a soul. I could not feel vulnerable. I don't know if it was my ego or my training or the system, but that's what it was. I'm here today because there are folks like Patricia Cuff and others at the National Academy of Medicine, folks like Dr. Zhao, who really cared. And as the next generation, as a young health professional, I just want to say how important this work is from our perspective. This is our community, and we want to take action. And if any of you are in the audience today, or by God, if you're on the web, and you want to share your perspective, you want to share your story, find me. This is how we build movements. This is how we build campaigns. It's the marriage between the technical and the social. So with that, I wanted to start to invite and I want to really thank Victor, Tom, and Daryl. To take this on as leadership is not an easy task, and it takes so much courage, and I'm just very thankful. So can I have members of the Research, Data, and Metrics Working Group and the Conceptual Model Working Group come up on stage? So as Victor mentioned, the collaborative met for the first time in January, and it was decided to self-organize into 4 working groups. For those who practice medicine or in the health professions, nursing, et cetera, you're sort of familiar with the SOAP note, a progress note. The subjective, the objective, the assessment, and the plan. The subjective is the history, the narrative, the story, the communications. How do we think of this? How do we share that story? The objective is the data, the metrics, the measurements. What is known, what is not known, and what do we know that we don't know? The assessment. How do we put this together? What is the conceptual model, and how do we conceive of this? What is the diagnosis? Most importantly, where a lot of clinicians, including myself, struggle, but it's the secret sauce, what is the plan? What is the action? What is the set of interventions? So we have 4 working groups: research, data, and metrics, conceptual models, external factors in workflow, and messaging and communications. So the way this is going to work is each working group has 2 leads, and they will present for 10 minutes, and then we will have a reactant, a response from an invited expert. The first group will have 3 speakers, because Lottie up here? Perfect, will also be speaking about her paper. So I'll introduce the first group. It's Steve Bird from the Society for Academic Emergency Medicine, Robert Harbaugh from Society of Neurological Surgeons, and Lottie Derby from Mayo Clinic, and then we'll have a reaction from Tate Shanafelt, also of Mayo Clinic. Thanks. So over to you, Bob.